involved with RSN for nearly 15 years. Support from someone who's been there makes all the difference.
Hey David, what are you listening to?
Kidney Talk, an online radio podcast that talks about kidney disease and the prevention of it.
Oh, cool. Where can I find that?
Oh, you can download it on iHeartRadio, Google Play, and Apple Podcasts.
Oh, nice. I'll definitely have to download that.
Shout out to Renal Support Network, the annual Renal Support Network essay contest. I won the Renal Support Network contest last year, the Warrior, and we are all warriors. So thank you. Keep on doing all that you do, and be happy and healthy and keep the hope. Thank you, Renal Support Network. Woohoo!
As a kidney transplant recipient, I find that having an actual publication like Kidney Talk is an invaluable resource for any kidney warrior at any stage.
RSN keeps me informed of kidney advocacy issues so my voice can be heard.
I'm really looking forward to the prom this year and meeting people who are just like me. Dressing up is super fun and all the activities are amazing. Can't wait to see you there.
Hi, I've been participating in the Renal Support Network 30-minute fitness Zoom classes. Not only have I lost 15 pounds, but I can also strike a yoga pose like this.
When I created Renal Support Network back in 1993, I had no idea the impact that I would have among my peers. An illness is too demanding when you don't have hope, and peer support, education, and knowledge are crucial to our survival. We have a great week planned with some incredible speakers, great information for you to share, learn, so we can survive and thrive with this illness. It's imperative. So stay tuned. We're going to have a great event, and a shout out to our corporate mission partners for making this happen.
Our next speakers, we have two wonderful new speakers. They're going to be talking about delaying the progression of kidney disease. And we have Dr. Dugan Maddux and Dr. Jennifer Finch. I'm going to share a little bit about them. Dr. Maddux graduated from Vanderbilt University and attended medical school at the University of North Carolina. She stayed in Chapel Hill for internal medicine residency and nephrology fellowship, and subsequently joined the Danville Urologic Clinic in Danville, Virginia, for 18 years of private practice in nephrology. She is now the Vice President for Kidney Disease Initiatives for FMCNA. She and her husband have also developed Voice Expeditions, which features the Nephrology Oral History Project, a collection of interviews of the early dialysis pioneers. Wow, how cool is that? Dr. Jennifer Finch joined the Renal Specialists of Houston, woohoo, my hometown, one of my hometowns, and shares in the house, lifting her hand. We have some Texans in the house. She serves as, she's a native Houstonian, and I got all happy and stuff, so let me back up. So she joined Renal Specialists of Houston in 2004 after completing a fellowship in nephrology at the Baylor College of Medicine. A native Houstonian, she serves as clinical associate professor for Baylor College of Medicine and sits on multiple hospital committees that address quality of care. Dr. Finch is a fellow of American College of Physicians, also known as FACP, and a fellow of the American Society of Nephrologists, ASN. She is on the medical advisory board for Fresenius Kidney Care. Many of us know Fresenius at the national level, serving as Houston's representative. She is also medical director of Fresenius Kidney Care, Moody Park, and Cypress Creek Dialysis Facility, which I know where those are. So let's welcome our two speakers. Thank you guys so much for being here to add to this wonderful Hope Week. What a great day we have.
Can you guys hear me?
Yes.
Okay, so I think I'm going first. I'm Jennifer Finch. I'm the one from Houston, where we're still actually not even wearing sweaters yet. I'm going to go ahead and start sharing my screen. I'm going to talk about things you can do to delay progression of kidney disease that you may already be doing or you may not know about. And a lot of it will be geared towards things that you can talk to your doctor about, not necessarily things you will just run out to the grocery store and do. So let me get my screen shared. And it doesn't necessarily matter what disease you have that caused your kidney disease to say that some of these things may help. They're independent secondary factors. So basically, the first thing we have to ask ourselves are, how does kidney disease get worse? How can we slow down how fast it gets worse? One of the things I like to tell my patients is we're all aging every day, and we all want to slow that down. And just like we want to not get wrinkles or not have our hair turn gray, we also want to slow down how fast we're getting worse, and that's kidney disease as well. So how does it get worse? Well, there are two ways essentially that you can think of. One is the primary cause of the kidney disease causes your kidneys to get worse. So no matter what that primary cause is, if it's something that tends to worsen with time, then the primary cause can cause it to get worse. The other thing is the secondary causes. Secondary causes that lead to progression are what we're going to discuss here, and they may not be related to the primary cause of kidney disease much. And that's one of the things that's important. So what are the main things we can do to protect our kidneys from this progression? Well, separate from that primary disease, whether it be polycystic kidneys or glomerulonephritis or whatever you have, certain things can cause your kidneys to worsen, or preventing these things can cause that worsening to slow down. So we want to control things like blood pressure, protein in the urine, certain medications, ACE inhibitors, or what's called ARBs may be beneficial, limiting protein intake, watching salt intake, not smoking at all, but also stopping smoking. Stopping smoking can help you. So when people say, I've already done the damage, not really. If you stop, you can make a benefit. Controlling your sugar, controlling your weight. Those are all things that would help if you want to slow down progression of kidney disease. When I say controlling blood pressure, what do we mean? As many as 85% of people with chronic kidney disease have high blood pressure. As your kidney function declines, the incidence of high blood pressure increases, meaning the lower the kidney function, the more likely it is that you have an issue with high blood pressure or take a medication for high blood pressure. In general, and this is general, it's not for everybody, the goal blood pressure is usually 120 to 130 over something less than 80 if you have chronic kidney disease. Now, every patient can be different with that, so other medical problems may cause your doctor to recommend something else, but this is a general guideline. What about protein in the urine? Protein in the urine may contribute to worsening kidney disease in and of itself. Reducing the amount of protein that's coming out in the urine can result in a slower decline in the kidney function. There are certain medicines that are shown to decrease that protein. Those are the ACE inhibitors I mentioned, the ARBs, and now the SGLT2s, which are a new medication that has just come out. And these are all things that require a prescription. Your doctor would look at it and say, is this indicated for you? But decreasing protein in the urine may be a good idea. And this is a place where you're not expected to know these things, but it's something to bring up with your doctor. How's the protein in my urine? Am I controlling this? Am I meeting my goal here? What about blood pressure pills? We've talked about that you should control your blood pressure. Is some medicine better than the others? For some people, ARBs may be more beneficial, or ACE inhibitors. These are medications that reduce blood pressure and protein in the urine, and may slow progression in patients with chronic kidney disease if they have diabetes or other medical issues. There are other blood pressure pills that also slow progression and control blood pressure. These are two that are popular if you like to do Google or like to look things up that will pop up. So it's important if your doctor has you on one of these and you've wondered, why am I taking this pill? You could ask him, am I taking this pill to help my kidneys? Some people are on these pills and they're told you're just on these pills to help your kidneys. So these are another discussion topic for patients to discuss with their physicians. What about dietary changes? If your kidney function is a little below normal, is there any benefit to changing your diet? And there may be, and we can't say for certain, but there may be some benefit to modest reductions in protein intake. Not severe reductions. We shouldn't all stop taking in all protein altogether today, but modest reductions in protein intake. There also may be a benefit to watching sodium intake, because this may slow the progression of CKD as well. CKD being chronic kidney disease. Sodium, as we probably have heard about all over the place, is in our fried foods, fast foods, canned foods, and there may be some benefit to trying to decrease the sodium intake. What about smoking? Smoking significantly increases the risk of chronic kidney disease. When you compare non-smokers to current smokers, there is an increased risk of CKD. Former smokers, and like you smoked in the past but you quit, usually don't have that significant risk. And that's why I say when people say it's too late for me, it may not be. It's probably worth it to still quit smoking because it may slow the progression. What about acid in the blood? This is something that nephrologists talk about, and you may see on the computer looking things at. As kidney function declines, patients may see that they don't neutralize the acid, or their acid-base balance gets abnormal. Either way, depending on diuretics they take or on the kidneys not neutralizing acid in the blood. Sometimes nephrologists will prescribe medicine to help with neutralizing that acid, and doing that may slow the progression. What about glucose? If you're diabetic, does it matter how your glucose is? Controlling your glucose can slow the development of the protein in the urine, which we talked about earlier, and decrease the kidney function loss in diabetic patients. If you have diabetes and your sugar's out of control, it's important to let your doctor know and get it under control, because that may slow down how fast your kidneys get worse. How about weight? It's a good idea to maintain a healthy weight. Being overweight can increase the progression of chronic kidney disease, and it leads to other things. Makes your blood pressure higher, adds to protein in the urine, makes the diabetes harder to control. So by losing weight, you may help several things on the list of things that you want to control. Get your blood pressure a little lower, decrease protein in the urine. So maintaining a healthy weight is important with chronic kidney disease. What about these medications? There are new medications that are recently out that are very exciting for nephrologists, because there may be some delay in progression in certain people with diabetes that are treated with these new medications called SGLT2 inhibitors. And those are sodium glucose transporter 2 medications. And everyone is excited because they may slow progression of chronic kidney disease in diabetics. These are new, and that may be a reason that your doctor would recommend changing your medications. These are medications used to help control glucose by way of the kidney, and are shown to be somewhat beneficial. So overall, as time passes, what are the things you can do? You know you have chronic kidney disease. You don't want it to get worse. You want to slow down what's happening. So what should you do? First step is, I would say, maintain a healthy weight. Try to get your weight to a reasonable level. That seems to be a daunting process, but every little bit counts. So try to maintain a healthy weight. The second thing I would do is control your blood pressure. And that's not something you might you're going to be doing at home by yourself, it's mainly going to be paying attention to the readings, and depending on what the readings are, you would go ahead and report to your doctor. If your blood pressure is running high or you're having any kind of numbers that are out of range, don't wait a year. Go ahead and address it. Protein in the urine. You can ask your doctor, are you meeting all the goals to keep your protein down? How about your diet? Are you eating a lot of salt, anything like that? You might want to look at it. If you're smoking, stop smoking. Talk to your doctor about the acid in your blood. If you're monitoring your glucose and it's consistently too high, let your doctor know and let's get it under control. Also work on, like I mentioned before, the weight. So there's lots of things that you can do that make you proactive in your care, still involving your medical professionals, but make you really proactive. This is what I'm watching and this is what I want to do. So that was a few more pieces to the puzzle of slowing progression of your kidney disease. That's all I got. Do you guys have any questions for me?
So we do have one in the chat box. The question is from Elizabeth Jones, and she says, what do you suggest to lower cholesterol instead of prescription medications? I have had CKD for 30 years and am in currently stage 2 mild.
So that is hard to just pick without all the parameters and the whole history. But what I can tell you is your physician should be able to tell you if you're running high for the LDL or the triglycerides or what those things are. Some people do, depending on your other medical issues, there are some over-the-counter things you can recommend, but it really depends on how high it is and if you can take these things without danger with your other medications. Probably your best bet, if your physician doesn't have a recommendation, might be to talk to a dietitian as well, because sometimes they're able to look at all of it too. So I wish I could give you a specific answer, but it's so broad depending on what you have that it's probably best to go to your doctor, if not a dietitian as well.
Right, thank you. So the next question is, what is best for keeping transplanted kidneys healthy?
Okay, so everything on that list that I just said, none of those things will hurt you if you have a transplanted kidney. Taking your medications in compliance with your medications and labs. When we run out of our transplant medicines, we stop taking our transplant medicines. We miss them for 5 days. Those aren't good. You for sure want to get regular checkups by your nephrologist if you have a transplanted kidney, because they can watch for evidence of kidney disease. We often check for protein in the urine and things that you might not see at home, any issue that we would see first. I would say that's about where I would start. Everything on the list we presented, plus taking your medicines and going to your visits.
Okay.
Wendy, let's move on to Dr. Maddux and take the questions at the end. Maybe she's going to answer them.
Okay, perfect.
Okay, so I'm going to go off now. All right.
Okay, thank you so much.
I'm still here, but I'm just...
Yes.
All right, let me try to share my screen. Let's see. There we go. And slideshow. How is that?
Perfect.
All right, good. Well, thank you, Lori. Thank you for having me. I'm just delighted to be here to be a part of this RSN Hope Week. And I hope that some of what I'll talk about will dovetail a little bit with what Dr. Finch has just talked about. But my goal is to talk a little bit about the social determinants of health. So a little bit different perspective of what impacts CKD, but we're definitely going to talk about lifestyle and diet for sure. So the Department of Health and Human Services every decade sort of convenes a group of stakeholders and collaborators, researchers, policymakers to talk about what the hope is for improving the health of all Americans in the United States. And so in 2010, they came together and developed some goals for Healthy People 2020. And so a lot of research has been done over the last decade to try to look at social determinants of health. What happens in our environment that may change our health outcomes. And at the time in 2010, 7 out of 10 Americans had health issues related to chronic diseases like diabetes, high blood pressure, heart disease, and chronic kidney disease. So it's been very important over this decade to look at what things in our social environment might impact that. So in our environment, we live in communities, work in communities that may impact our health outcomes, and our socioeconomic status of our communities, our neighborhoods may impact diseases like chronic kidney disease. So in order to improve the overall health of people with chronic diseases, there's been a lot of research looking at the impact of stable housing, having access to good education, living in safe neighborhoods and communities, and what is the impact of having access to nutritious and healthy food, and having access to good health care. So that's what I will talk a little bit about today. And I'll just make a note that we really, when we think about healthcare for a very long time, we've really thought about a lot of the things related to what medicines you should take. And as Dr. Finch just mentioned, ACE inhibitors, SGLT2 inhibitors, those are all part of what we would think about with CKD with traditional healthcare. And having access to good hospital care, dialysis care, all those things are really important. But research has shown us that socioeconomic factors like having a good education, a stable job, having access to community services, and having healthy behaviors. Jennifer was just talking about smoking and tobacco use. These things may affect or do affect our chronic disease outcomes, even more so than just our traditional healthcare does in many ways. So we want to bring those things together, traditional healthcare interventions along with social determinants of health interventions. So I'm going to spend just a few minutes talking about a couple of studies that are very specific to chronic kidney disease and social determinants of health. So in 2009, the Clinical Journal of the American Society of Nephrology brought together a lot of research publications, looked at them, and found that there is good data to show that a healthy diet pattern can lower your risk of chronic kidney disease, so that you're less likely to develop CKD if you're eating a nutritious or healthy diet. I think we heard earlier about the DASH diet, the dietary approaches to stop hypertension, which is a diet rich in fruits and vegetables and low in saturated fats and sugars. And the MDRD study, which was looking at protein intake and the incidence of CKD. And there are other studies looking at nutritious diets that are very rich in fruits and veggies. And it's clear that if you can eat a healthy diet, then you're had lower risk for developing CKD. And in 2017, in the American Journal of Kidney Disease, there was specifically a study that looked at food insecurity and whether that was associated with CKD progression. And it became clear from the data that food insecurity, which impacts your ability to have access to nutritious food, is associated not only with the increased risk of CKD, but also an increased risk of CKD progressing to end-stage renal disease and the need for dialysis or a kidney transplant. And also that the food insecurity issues are associated with people who have socioeconomic challenges, who may live in poorer neighborhoods and have other stressors related to poverty. And lastly, I'll mention this publication in Seminars in Nephrology in 2019, which pointed out that we can look in the United States and actually see that there are communities and areas that are CKD hotspots, that people living in socioeconomically challenged neighborhoods have an increased risk of CKD, an increased risk of CKD progression, and an increased risk of being on dialysis. So these are literally neighborhoods that are hotspots for chronic kidney disease, related to social determinants of health and specifically related to food insecurity. And in this article, they also point out that probably CKD is related to socioeconomic challenges in a bidirectional way, meaning that people that are having socioeconomic stressors, that have issues related to poverty, they might be difficulty with housing, be unhoused, difficulty having access to nutritious food or good health care, that those create stresses, psychological stresses, physiological stresses, inability to access health care, inability to access nutritious food, and for those reasons, they are at increased risk for chronic kidney disease. But also, people who have a chronic disease like chronic kidney disease may have more difficulty with being employed, having more missed days at work, having decreased income, having increased expenditures related to buying their medications, seeing their doctors. And so in that way, people who have CKD may become more impoverished. So it's sort of a vicious cycle, which we need to really be thinking about and be aware of. And food insecurity in particular does create the problem where we have poor diet quality. We have people who have more sodium intake, who may be eating less fruits and vegetables, may have a higher dietary acid load, and that directly is toxic to the kidney and bad for the kidney and leads to CKD. But also people who have food insecurity are often making trade-offs. So they're trying to decide, am I going to pay my rent this month, or am I going to pay for my medications, or am I going to go to my doctor, or am I going to buy good food? And so those trade-offs also make them at increased risk for CKD. And then it's pretty clear that living with that kind of stress all the time, that chronic stress, just activates some of our hormonal responses and neurologic responses, and that chronic stress probably activates more vascular injury that also leads to cardiovascular disease and chronic kidney disease. So there are physiologic, psychologic, and social issues related to some of our social determinants of health. And I'm going to spend the last few minutes just talking specifically about, can we use food as a medicine? Can food really change health outcomes? So I've mentioned before food insecurity, which is really lack of consistent access to enough food, enough nutritious food to lead a healthy life. And I'm going to talk a little bit about this movement around food is medicine, meaning that are there health interventions that can change a chronic disease outcome? That it addresses the fact that there is a link between nutrition and chronic disease, which is what we've been talking about a little bit over the last 30 minutes. So this was a graphic put out by Hunger in America several years ago, and it notes that food insecurity does impact our health. So 24% of households had at least one member in poor health, 33% had a member with diabetes, 58% had a member with high blood pressure, and 66% of households had at least some moment where they had to choose between food and medical care, that they were difficult choices with limited resources. So that 48 million Americans, and probably more now, and probably more during this time of the pandemic where there have been issues with regard to work, that 48 million or more Americans live with food insecurity in the household. So this has led to a lot of study to look at how can we use food as an intervention to change the outcomes for chronic diseases, and particularly chronic kidney disease. And I'm showing you here a picture from the Massachusetts State Plan on Food as Medicine that was just published in the last year. And so this pyramid of interventions goes from these sort of basic interventions at the bottom, which will try to address preventing chronic disease like chronic kidney disease. Can we help people have consistent access to enough nutritious food that they aren't at risk for some of these chronic diseases like diabetes, high blood pressure, and kidney disease? So these basic preventive interventions, food interventions, would be like the Supplemental Nutrition Assistance Program, or SNAP, or food pantries, the WIC program. Also in a sort of prevention for very specific populations would be like school lunches. Can we start kids out really having at least 1 or 2 healthy meals? And not only will that make them healthier as they grow, but help them to have some visibility on what a healthy diet should look like. And then as we move up the pyramid, we get more interventions that are designed to actually treat chronic diseases. So the produce prescription program is where if a provider knows that a patient has diabetes or high blood pressure, they in some instances have the opportunity to write a prescription that allows the patient to get a voucher or some kind of credit to go to a farmer's market or a grocery store that's in partnership to have access to fresh fruits and vegetables at either no cost or low cost. And then even more specific for diseases would be medically tailored food programs or medically tailored meal programs where providers are taking care of people with multiple chronic conditions. They need to have food intervention that's specifically tailored to help control that condition, control sodium, control glucose intake. And so we get into medically tailored meal and medically tailored food programs. And I want to just show you a little bit of an example of those. So the food pantry would be to say, we want to make it so you don't have to make any difficult choices about where to spend your money every month. And we can give you generally nutritious food for you and your family. And so that is the food pantry prevention kind of intervention. A school lunch that's a very healthy, balanced meal once or twice a day for school children. And moving up the pyramid to the produce prescription programs where a patient who has some early chronic disease or risk of chronic disease can get a voucher to help increase an intake of fresh fruits and vegetables to slow progression or reduce risk. The medically tailored food, an example that's been around for almost a decade now, is the Fresh Food Pharmacy at Geisinger. And they have published data and done research to show that if they take their diabetic population and the providers who are taking care of them can write a prescription for them to go to the Fresh Food Pharmacy where they have food that's tailored for their diabetes, for them and their family, where they have access to nutritionists who can support them, that they can actually lower hemoglobin A1Cs and prevent progression of problems related to diabetes. And then the medically tailored meals where a patient is receiving meals, 2 or 3 meals a day, 1 week at a time, over several months to 6 months, that allow them to stabilize multiple chronic conditions from chronic kidney disease to heart disease and lung disease. And I'll talk specifically for a moment about Community Servings, which is a medically tailored meal nonprofit in the Boston area. And they provide meals to thousands of families every month that are medically tailored for at least one individual in the family who has chronic medical conditions. They started out feeding patients who had HIV in the 1980s who needed increased protein and calories. And now they feed people with all sorts of chronic diseases where the provider can write a prescription that comes to them and then they tailor a meal plan for that individual and that individual's family. And about 20 to 25% of the patients, the people in the Boston area that they feed have chronic kidney disease or end-stage renal disease. And Community Servings, along with a number of other nonprofits for medically tailored food and medically tailored meals around the country, have come together to form a coalition to try to say this should be available in all communities to all patients who might benefit from it. And this is a very busy slide, and I just want to finish up with this to say that food and social determinants of health today do still sort of sit outside our mainstream healthcare delivery system in many ways. But there are advocates and plans to try to bring these interventions back into more of our mainstream, what we view as our mainstream healthcare today. One of the places to start is to say that we ought to be screening patients for food insecurity and other social determinants of health issues, just like we're taking a past medical history or a family history. We need to explore anything they might have with needs for with regard to food insecurity or housing instability. And that if we're screening for that, we need to have ready access for interventions and resources that can address those needs and fix those needs for patients. So in the same way that a doctor might send a prescription to your pharmacy, they would send a prescription to a group that could provide an intervention for housing or for food, in the same HIPAA compliant data exchange way that's integrated into our health system today. And that these organizations that are going to meet the needs, let's say, for example, with food, whether it's a produce prescription or it's a medically tailored meal or medically tailored food, that they have very easy ways to provide that food or those vouchers directly to the patients and the families that need them. And that will get paid for through our traditional system of healthcare insurance, Medicare, Medicaid, that private insurers would be willing to cover this as a benefit for people who are insured by them. And today, commercial insurers and Medicare Advantage programs do provide food interventions because they've seen that they can decrease hospitalizations and control healthcare costs by providing them. And I just want to say I was super happy to see the essay contest for RSN and the annual essay contest event around food. And I think these essays are a great example of how important food is for how we feel about our quality of life, not only to control sodium and potassium and phosphorus, but to give us choices and allow people to really feel well and do well and live a healthy, happy life. And I think that's all I have. So I will try to stop sharing and see if I can get back to video.
Wow, what exciting information. I'm so impressed, and I love the fact that you talked about the social determinants of health. I think it's something that often doesn't get talked about very often, and what an exciting plan. I see that we do have a lot of questions. But one question I do have right off the bat, do you know of other states that are working on food prescriptions or who are receptive to this?
Yeah, that's a great question. And so, yes, I would say through the Food is Medicine Coalition in particular, there are communities all around the country that are working on these types of programs. For example, in Washington, D.C., they've had a very active prescription produce group, and in New York they've had God's Love We Deliver, which is a medically tailored. So I think that we are going to see more and more of these, and again, a lot of them have been sort of nonprofits, you know, food pantry type things, just supported by local communities and supported by donors and volunteers. But I think we're going to see, because research has shown that these interventions really change outcomes, I think we're going to see that some of these organizations will become part of our healthcare system and be funded through insurance companies and as a benefit.
Well, I'm definitely going to check this out. I really love the whole idea. So we do have some questions. Lori, just let me know when I should stop because of the time, but I see quite a few questions that have come in. So Dr. Finch and Dr. Maddux, you guys can decide who will answer what. The first one is from Shauna, and she asked, would SGLT2, the new drug, help people without diabetes?
So that's a good question. Dugan, do you want me to do that one or you?
Yes, Jennifer, go ahead.
I would say, so the most recent studies are looking at people with diabetes. I know that they will go, I'm sure there will be more information coming out, but most recently it's about individuals with diabetes. Let me try, I'm going to click this. Do you have more to add to that, Dugan? I think it's early to say. Go ahead.
I do think that the kidney protection is probably independent of the diabetes control. And so I do think that there will be an effort to see if we can use it even for people who don't have diabetes. But I think these original studies are in people who have diabetes.
Okay, thank you. We have Duncan 24 who's asked, what are the best ways of controlling proteinuria?
So mainly that would be blood pressure control. I just jumped on this one, and Dugan,
Yes.
mainly that would be blood pressure control, weight control, and then adding medications like the ACE inhibitors and the ARBs as indicated. Now, it depends. If you have an immune disease like a glomerulonephritis causing protein in your urine or lupus, there may be other medications that are more immune oriented for your protein management. But generally, it's going to be blood pressure control, weight control, and then certain blood pressure pills.
Okay. Next question. Best sources for outlining healthy renal diet for CK1, CK2. This one we might can hold till the next speaker because we will have someone talking about the kidney diet. So Duncan 24, just hold on. James Warham has the question for the latest speaker. How do we get fresh, nutritious food as the norm to be affordable rather than only for those with reasonable income, which is a question we have since the beginning of time. We have the same issues of food inequality and food poverty in the UK, but it's a big problem in both the UK and USA.
Yes, it is a big problem. And there's no question that trying to buy fresh fruits and vegetables is often more expensive than, buying, like in the United States, we have sort of a problem with overnutrition because you can buy a lot of calories for a very low cost through fast food types of outlets. So I think number one is making sure that we as a society understand how important access to fresh food is. And I think in the United States, there's an effort to try to change sort of the supply chain so that we have places where farmers have extra food or communities have community-supported agriculture with additional fruits and vegetables that are available. How can we more easily get them to the people that need them instead of having to go through sort of our grocery stores and some of the traditional methods? So I think that it's going to take a long time. And in the meantime, the stopgap may be these things where food pantries or the supplemental nutritional assistance programs help people afford those more expensive fruits and vegetables. But ultimately, I think we need more local produce and we need better changes in our supply chain to get those fresh fruits and vegetables more directly to the people who need them in the local community.
Okay, so we'll take one more and then we'll move on to our next speaker who I think could answer some of these other questions that people have. I see the questions on protein, which I think our next doctor could also talk about, but this might be one for you, Dr. Maddux. How can a patient medically tailored meals and meal plans when renal dietitian are not available? So basically, I guess they're saying, how could they do it on their own? I have multiple conditions that contradict each other and can't find help developing a tailored meal plan. So do you have any advice for that?
Yeah, and it can be very complicated. And I think without a specific, especially when you have multiple chronic conditions, you're trying to address all of them at once. It can be very complicated and almost impossible to do without professional help, like a nutritionist or dietitian. And so I would say if you have access to a nephrologist, a nephrology practice, see if they can't help you find a dietitian. And also providers now, like insurance providers or payers, sometimes have those resources available to you as well if you're part of a health plan. So I think look around to see if you can get some professional assistance, because it's very difficult, I think, and Jennifer, you should chime in, but I think it's very difficult to make sense of it all and to combine multiple complicated diets without some professional help.
Totally agree. That's very true.
Okay, thank you so much. This was such interesting information. I love the idea of food as medicine, and thank you so much for sharing that. It's very, very informative. I see that the information was put in the chat box. So for those of you that are interested in learning more, please grab that information for the chat from the chat box. And remember, this is recorded, so you'll be able to go back and look at this again.
And a shout out to our corporate mission partners for making this happen.